This type of sponge holds the moisture well, has lots of little nooks and crannies for food particles to get trapped, and the microorganisms will use that.
Germs lurking in your kitchen. The Centers for Disease Control say 1 in 7 home kitchens would not pass a restaurant-style health inspection, and only 34% would receive an A rating. So how do you think your kitchen would compare? Well, with Thanksgiving just a week away now, there's still time to make sure your kitchen is safe. KXAN's Katina McHenry shows you how to clean up and pass the test. Okay, Katina, show us what to do.
Okay, here we go. Well, obviously, a week from today, our kitchens are going to be bustling with people preparing food in and out of the kitchen. And while the counters may look clean, it's what's hiding in places where we can't see that may be dangerous.
I just want this.
Oh, we're definitely going to eat that now.
For most people, tasting a bite of delicious spaghetti and meat sauce is all their taste buds care about.
I think the Italian sausage is what sets it out.
But wait, where were those ingredients before they were added to this platter? And how clean is the kitchen it was cooked in?
What we're concerned about is pathogenic bacteria, which actually can cause foodborne illness.
A study by the Centers for Disease Control shows 15% of homes would fail the cleanliness inspections given to restaurants.
Okay, my house, I would not want them coming to my house.
And of those that passed, only 1 in 7 would get an A.
I'm just freaked out by germs.
Meet busy North Austin wife and mother of 2, Pam Owens.
After watching years and years of specials about E. coli and germs in the kitchen and people getting sick and ending up in the hospital over raw meat, I'm just a little anal about kitchen area.
Travis County Health Inspector Celeste Parker is tough on restaurant kitchens, and today she's putting Pam's kitchen to the test.
Food safety is definitely equal when you're talking about whether it's a restaurant kitchen or a home kitchen.
On any given day, Pam says this is what her kitchen looks like. Countertops and cabinets are wiped down with no dishes left in the sink.
I cannot go to bed until it's cleared out in the sink.
Inspector Celeste scans the kitchen looking for violations that she may find in a restaurant kitchen, like dirty rags left out or no hand washing. So far, Pam's kitchen is passing the test. But germs hide in places we can't see, so we took the test a step further, swabbing samples of a scrubbing sponge and the sink trap, and we headed to UT's Molecular Genetics Microbiology Lab.
The problem organisms for kitchens are those that cause foodborne illnesses.
First, we test the red sponge.
And as you can see, the surface has a large number of bacteria on it.
And then the sink trap.
And here we got quite a bit of growth. As you can see, the plate was almost covered with things.
Bacteria, but no signs of foodborne illness, which could be as serious as E. coli, salmonella, or even as deadly as staph infection. But what restaurant health inspectors are most concerned about is food handling and food preparation. So if you knew a state health inspector was coming to your home to do an inspection, obviously you'd all but hire an industrial cleaning service. So we decided to come back and surprise homeowner Pam and bring along our health inspector Celeste. Hello, we're here for dinner. On today's menu, spaghetti with lots of meat. A perfect scenario to see how Pam handles raw food.
One key thing, especially with working with a recipe that has the raw meat, is that she was very conscientious of what her hands had just been doing, so she was washing her hands in between tasks.
One suggestion?
When the cooked meat was sitting over here beside the sink, would be possibly to move it away a little bit just to prevent the risk of any splashing when hands are being washed.
Today, there is good news for Pam's happy and healthy family. She and her kitchen get an A. The question now is, would yours? Okay, so if you want your kitchen to get an A, here are a couple of solutions. First of all, your sponges, replace them often, or you can soak them in bleach water. That gets rid of all of the germs. Microwaving them doesn't always nuke all of the germs. It's also true for the sink trap. Also, soak it in warm bleach water to get rid of the germs. Some other things, wash your hands regularly in between tasks, especially when you're going from using handling raw food to vegetables and raw vegetables and fruit. Also, remove jewelry when you're cooking. And once dinner is done, don't leave it out for more than 4 hours. And obviously, next week, people will be preparing food for Thanksgiving, and many times people leave the turkey out on the stove or on the table, and that can be dangerous. So make sure you put it in the refrigerator, and the refrigerator has to be at least 41 degrees. Now, if you go to our website right now to KXAN.com, you can take your own test and see what grade you get. That is at KXAN.com. We are live in North Austin. Katina McHenry, KXAN Austin News.